Good afternoon, viewers. We regret the technical snag and the delay thereof. Heart diseases is a term covering any disorder of the heart, unlike cardiovascular disease, which describes a problem with the blood vessels and circulatory system as well as the heart. Heart disease refers to issues and deformities in the heart itself. To know more about heart diseases, its prevention and contemporary management, we have with us today Dr. Harikrishnan Parthasarathy, Consultant Cardiologist, Apollo Hospitals, Varnagaram. Good afternoon, Doctor.
Good afternoon.
Doctor, why is it important for the general public to know about heart diseases?
So if you see the stats now, it is very worrying stats actually, because in India, we have lots of younger people developing heart disease. And also the awareness for heart disease is growing, but still not good enough, I think, actually. I think we should be aware of the numerous risk factors of the heart disease. And if you take preventive measures very early in life, then you can prevent a heart disease and prevent big problems in the future.
Doctor, what is the link between heart disease and smoking?
See, one of the top risk factors for heart disease is smoking. Then if you see any statistics in the world, like 30 to 40% of people smoke. And in the Western world, it is worse because men and women smoke equally. But in India, I think that stats is more towards men actually. Men smoke more than women. But if you think the problems with smoking is enormous actually. Heart disease is a major problem. So it can clog up the arteries, it can increase the cholesterol formation in the arteries, lead on to a major heart attack. People as young as 20s and 30s, I have several patients who has developed a major heart attack and even death actually because of smoking.
What is a coronary artery disease?
So coronary arteries are coronary means crown actually. They are shaped like a crown. They go around the heart and they actually supply all the sides of the heart actually. The coronary arteries more so are very vital because these are the ones which get affected when we have a heart disease. And we talk about blogs. People often confuse coronary arteries with valves. So coronary arteries are different, valves are different. And when you talk about the health of the heart, mainly we are concentrating on the coronary arteries.
Doctor, what are the symptoms of coronary artery diseases?
So coronary artery disease usually cause what we call angina. Angina is a pain, chest pain, or pain in the jaw, anywhere from the jaw until the umbilicus. People can have pain in the left, right, or the back. And people usually have them on exertion and get relief on rest actually. But it's worrying fact is like about more than 50% of heart problems don't really show any symptoms these days. They are all silent problems. So better to get it checked earlier. People can also get breathless. People can have breathlessness while doing things. After a heavy meal, they start walking, they get breathless. And also people can have palpitations, dizziness. All these things are common symptoms.
So what, Doctor, what could be the risk factors of a coronary artery disease and of heart attack?
So risk factors are usually classified as major risk factors or minor risk factors. Major risk factors also we can classify as modifiable risk factors or non-modifiable risk. Non-modifiable risk factors are aging, being a male compared to female, and genetic factors. These factors or inevitably we might have problems actually. On the other hand, modifiable risk factors, we have things like diabetes, hypertension, smoking, obesity, lack of exercise, on all other novel risk factors as well.
How dangerous a blood clot in the heart can be?
So blood clot in the heart usually can produce what we call a major heart attack or full attack or ST elevation MI, and it can 50% of these patients may not even survive on the day. That's sort of a major problem. It actually usually forms on top of an existing what we call a plaque or a cholesterol in the coronary arteries. And sometimes it can present as a minor heart attack, also what we call a non-ST elevation MI. It can partially occlude the blood supply and can lead on to a heart attack.
Doctor, what is the chance of having a blood clot after heart surgery?
After a heart surgery, usually the risk is very low because we are actually treating it, and if you take appropriate medications and treatment, then it's very low. But still, people are prone for heart diseases in spite of all the preventive medicines, and we have to be careful even after bypass surgery.
We have a very interesting and important question, doctor. Is heart disease an irreversible condition?
Heart disease is not an irreversible condition. We can reverse it with good lifestyle. If, for example, if somebody has a very narrow coronary arteries, if we completely do plenty of exercises, there's a good chance that the coronary arteries can grow bigger. And there is also studies which we have seen. If you have put a camera inside the coronary arteries, and if there is a cholesterol, it can be regressed with good appropriate medications and measures. So it is a changeable condition. We can actually reverse it back to normal also with good medications and modern techniques and lifestyle.
My grandparents had heart diseases. Is it possible for me to develop one?
Always the family history plays a vital part. As I told, it is one of the non-modifiable risk factors. So if you have anyone in your family, close family, from father, mother, or grandparents, or your uncle, maternal uncle, paternal uncle, or your own brothers or sisters, you better get checked for a heart disease.
Is hypothyroidism a risk factor for heart disease?
So thyroid is an activity hormone. It usually is in the neck, and it actually allows us to perform our day-to-day activities with actually vigorous activities. It helps. For example, if there is somebody has a low thyroid, then you can get swelling of the heart. You can get a collection of blood or fluid around the heart. If you have high thyroid, then it can lead to supraventricular tachycardia, lots of things. So thyroid is one of the important problems which can affect the heart disease.
Does being overweight increase the risk factor of heart disease?
Overweight is one of the minor risk factors. Being overweight is usually tied up with high cholesterol, obesity, lack of exercise. All these things are interlinked, as we know. So basically, obesity is also one of the risk factors.
Doctor, how can diabetes affect the health of the heart?
So diabetes is the worst risk factor for heart problems. For example, India is the diabetic capital of the world. India is also the coronary disease capital of the world. So we are actually, diabetes is like already having had a heart attack already. So it's so bad. So if you have diabetes, take adequate care, because diabetes, the sugar actually forms what we call a glycated end products. It gets deposited inside the blood vessels. It makes it very vulnerable for cholesterol growth inside. So even a normal cholesterol will be very dangerous in diabetic people. So take good care of your health. Diabetes affects head to toe throughout the body. All the blood vessels can get clogged up because of diabetes. So you don't think like one sweet you're taking today, it's okay. One wedding we are going, take one sweet like that. Don't have little excuses actually. Be very strict with your diabetic control.
How is heart disease related to stroke?
So heart disease is blockage of blood supply to the heart, and stroke is blockage of blood supply to the to the blood vessels, to the nerves in the brain actually. So it's all very closely related. People who have a heart disease are very high chance of developing a stroke also, and vice versa. So it's all to do with one tree with various branches. When you have clogging up of one area, it can get affected the other area. So you take adequate precautions. Sometimes there could be direct relation. The heart can form a clot inside and can dislodge and go to the brain also. So like that also there can be a relation. Sometimes the irregular heartbeat, like atrial fibrillation we call it, can lead on to a clot going to the brain also. So all these things are very important, and so anything related to the heart, we always check the brain and vice versa also.
What dietary changes should one make to reduce the risk of heart disease?
So see, I see lots of young people now, 30s, 40s, no other risk factors apart from just eating a lot. And they tell that is the only problem I have. And that is a major issue now. So diet has to be drastically improved in an Indian setting. We have a tendency to eat a lot of carbohydrates. Carbohydrates get converted into fat and cholesterol. And that is a major problem. Rice, idli, dosa, chapati, everything is, you have to take it in moderation. So eat plenty of fruits and vegetables. Plenty means you have to eat plenty actually. So the portion of rice should be very small. Eat plenty of vegetables when you eat actually. And also you, oil-wise, you restrict the amount of oil you're taking, whatever oil you take. Try to avoid saturated fatty acids like ghee, butter, vanaspati, or palm oil, all these things you try to avoid. Don't eat lots of bakery items, snacks. So the major killer is actually eating fried items, deeply fried items. For example, saturated fat is present in mutton, lots of red meat. Those things you try to minimize or avoid.
Speaking of risk factors, if I have the same risk factors for coronary artery disease, what would you suggest, doctor? What are the precautions I need to take?
So as I told, it's the summary of whatever I told actually. So all of us, it's a simple tips only. Try to eat healthy. Try to do plenty of exercise. Try to keep an ideal body weight. Try to be stress-free in a modern life actually. Stress is a major risk factor. People are running like haywire, headless chicken and try to do their commitments and unnecessary worries. You have to say no when lots of responsibilities come your way. Try to say no, take enough rest, go for vacations, keep happy lifestyle, spend more time with your family. But at the same time, nobody is telling not to work hard actually. I think all of us should work very hard. But at the same time, balance your life out actually and try to eat healthy and work more.
Doctor, what is a heart palpitation and should I be worried about it?
So palpitation is like a symptom of heart going very fast. Some people feel it more than others. Palpitations might be worrisome, may not be anything to worry. Young people get a lot of palpitation, especially ladies. There is a relation between the heart's going fast and hormones in the body also. So when somebody has a palpitation, it could be a good nothing to worry, like what we call a sinus tachycardia or sinus, or you can have other things like ventricular tachycardia, atrial tachycardia, fibrillations. All these things, I think you have to be mindful about what type of palpitations you get and get it properly checked.
What happens if heart disease is left untreated, doctor?
So heart disease, if left untreated, is a major worry. There is a chance of comorbidities. You have poor lifestyle, more symptoms. You have problems like lack of good quality of life and early death also. So better to treat it well and with the modern medicine, contemporary medicine we have, and plenty of good advices around actually, and then you get it treated properly early.
Doctor, what lifestyle should one adapt to reduce the risk of heart diseases?
Lifestyle wise, keep it simple, do more work and eat less. So few minutes in the lips, lifetime in the hips. So like this, you have to imagine one gulab jamun or samosas, 200 to 300 calories. So for that, you have to work for about 45 minutes on a treadmill to burn it out. So before you put it in the mouth, you think, is it really needed for me now? Is that going to be digested properly now? Today, most of the time, the answer is no. If you eat a late lunch, late dinner, then that day, if you are not able to work harder, that's going to go in the hips also. And you're going to have major problems. So try to lead a very healthy lifestyle, plenty of exercise, and eat less also.
Doctor, will taking an aspirin in a day reduce the risk of heart disease?
Aspirin is blood thinner, as you know. It actually, it's what we call, it inhibits the platelet activity. Aspirin is not for everybody. People who are having a high risk benefit from aspirin. People who are men benefit more than ladies when taking aspirin. So we have to tailor it according to the needs. So if you are thinking about taking one, you go seek your help of your physician or a cardiologist and decide accordingly.
How should one avoid heart disease?
Avoidance is, as we all know, prevention is better than cure. So you do from a young age. Don't think we are young, we are only 30, 40, we can eat whatever you want. From a young age, encourage plenty of good exercise. But lots of novel risk factors also, for example, pollution, dust, eating lots of chemical things, eating lots of processed food, junk food, all these things you have to be mindful when you're actually trying to prevent a heart disease. Exercise plays a major risk factor. Whatever the age you are, blood supply will grow if you exercise more. And if there is a big blood supply, then it can, the chance of clogging up is also less. Then take a very, attitude-wise, take a relaxed attitude in life. We are all running a marathon in life, I always feel. Take your time, slow down, take your breath and do your activities. People will always ask you to say this, that, do this, time up. All these things, time pressure plays a major part actually. Responsibilities, you don't take unnecessary responsibilities in your life. Do what is needed, take good care of your health. Little bit selfishness is not bad for us. You look after your body, look after your family, and then lead a healthy life. Money is not everything. You don't go behind money every time. Just earn enough, but spend your time in a judicious manner.
Doctor, what kind of physical exercise should one do to avoid heart problems?
So physical exercise, what we call a dynamic exercise, or you do plenty of what we call cycling, jogging, swimming. People can do plenty of yoga, breathing control exercises, yoga. People can train their mind to stay still and calm, meditation, and stress relief exercises play a major part. I think we have to combine everything. Little bit of weight training is also good. Don't take too much strain, but little bit of weight training also not bad for health. So tone up your muscles, do plenty of flexibility exercises, do plenty of exercises to increase your heart rate. For example, if your age, say 40, then you can actually increase your heart rate up to, say, example, 160. Then it doesn't hurt you in a regular manner. Then if you train your heart well, then in times of stress, you don't get that uneasy feeling in the chest actually. So you train your heart from an young age, do plenty of exercises. Regularity is very important. I often find people telling, sir, today I can't do this, today I am busy, I am actually stuck, I am unwell. So excuses, no, not allowed to lead a very happy and healthy lifestyle. Take a detached attitude in life. That's actually emotionally you have to be strong also.
Doctor, is surgery the only option to treat heart disease? And if not, what are the other treatments available for us?
So apart from surgery, medications, obviously, we know plenty of statins, aspirins, medications to strengthen the heart in weak hearts. But diuretics, people who have weak heart will collect water in the heart, then diuretics are helpful. But alternative medicines, for example, good healthy lifestyle and eating plenty of green vegetables, fruits also, good medicines also. As an adjunct, you have plenty of Ayurveda type of stuff also, but don't leave your allopathic stuff. And on top of this, lead a very healthy and happy lifestyle. So medications have to be taken properly. They are the basic, and surgery is the next only actually. So take the medications regularly.
Doctor, can fluid retention cause heart palpitation?
Fluid retention can cause palpitations because it increases the volume that heart has to work harder and to pump it out. So fluid retention can cause palpitations, and that's especially if people have a weak heart. People have, and if you drinking plenty of water, unless you have any heart problem, is not a bad idea. But once you have a heart problem and a weak heart, then try to avoid limit the amount of fluid, because heart will get really expanded with lots of fluid in a weak heart, and that is going to be a problem because you'll get breathlessness.
What happens if the blood flow in an artery is blocked or greatly restricted?
Blood flow in the heart is blocked. That is what we call, it can lead on to an angina because it's a cholesterol block, very stable block, or if it is acutely blocked, then lead on to a heart attack. So basically the blocks can be because of either cholesterol or a clot. So cholesterol usually is a gradual process actually, and suddenly one day there is a little ulcerated crater, we call it, it actually bursts open, and then clot can come on top of that and cause a proper heart attack, and that's a dangerous situation. So you have to try to avoid that.
Doctor, what are the complications related to a heart surgery?
So heart surgery usually are very safe. Either it's you can talk about angioplasty. Angioplasty is a minor, like a minimally invasive surgery, and it's not really a surgery. We don't do any cutting open. Just through a small hole, we can go in and treat as many blocks as needed. And it's very safe. 1 in 300 chance of anything to worry. On the open heart surgery is bypass surgery, as we all know, or valve replacement. All these things, even they're all in very safe hands in good hospitals. Very less than 1% chance of a problem actually. So if there's a need for any testing, if there's a need for any surgery, then you consult the appropriate people and go for it.
How is a heart disease diagnosed, doctor?
So heart disease, I think diagnosis is usually through either just look for the risk factors first, look for diabetes, look for hypertension, screen for those things, and look for other risk factors also, and like for example cholesterol. That done through routine master health checkups. I think all of us should do master health checkups. I say these days even from 30 years. So you have to go for a master health checkup. Yearly checkup is mandatory. I do it. I'm a fit person. Still, I do it for my family, myself, my children, and my father and mother, and my in-laws also. At the same time, we have to do like specifically ECG, echo, and treadmill. These things can basically look at all the aspects of the heart, and then can give a meaningful idea whether we are going to suffer from any heart disease in the future.
Doctor, what is the relationship between cholesterol and the health of heart?
So cholesterol, there is a little, for example, if you have a heart problem, then your cholesterol should be as low as possible. But somebody who have a little high cholesterol may not be always prone for heart disease. So there is no direct relationship, but still people know that overall bringing down the cholesterol in the body is a good thing for you. So all of us should actually, say young person, a little bit high cholesterol usually can be managed only by lifestyle changes. Don't need to take tablets straight away. But if you have a very strong family history, if you have people who in your family suffering from heart disease, stroke, or dying early, then cholesterol plays a major problem in you. So you have to be very mindful of this. In your case, if you have diabetes, if you have other problems, then cholesterol plays a major problem. It does havoc in your body. So those things you have to treat accordingly, according to your risk profile.
Doctor, who are the major risk of having a heart disease?
Major risk usually are men, usually older, but these days the age is getting younger also. From 30 we are all prone, even 25 I've seen lots of heart problems. And then a diabetic person who is leading unhealthy lifestyle, who are smokers and who don't take care of their health actually, who are stressful, type A personality, all these people are prone for heart disease.
Doctor, thank you very much. What would be the take-home message of today's show?
Take-home message is, I think I can even quote the heart, this year's heart's the quotation: "My heart, our heart, your heart." So take care of your heart well, and then take care of your people who are around you. Take care of their heart well. That means like you make your children do more exercise. Ask them to limit their junk food and avoid them if possible. And then you make sure the whole society which we live with is having a healthy lifestyle. And that is the take-home message. Thank you very much, Doctor. That was Dr. Harikrishnan Parthasarathy, Consultant Cardiologist, Apollo Specialty Hospitals, Vanagaram, Chennai. For queries and any kind of questions, reach out as 3020-7777 or 2653-7777. I repeat, 3020-7777, 2653-7777. There's a mobile number, 74016-80248. I repeat, 74016-80248. Thank you very much, Doctor. Thank you, viewers. Thank you.